Hi everyone, it's Sarah with ADDPC. I'm here to share a bit of Arizona's Disability Snapshot project, and I'm going to be talking about COVID-19. Listen, there's been a lot of changes in 2020 due to the COVID-19 pandemic, and that includes the disability services system. Arizonans with disabilities have really been affected by the pandemic, and so we're going to talk a bit about that. Of course, when things started to shut down in earnest back in March 2020, that included many day programs and other programs and employment opportunities for adults with IDD, and that really disrupted schedules. We saw a temporary pause in services and a new normal setting in group home settings, in residential care facilities, all regarding safety precautions. Now, that also extended to residential and medical facilities that started to ban nearly all visitors. And this was a big problem because people with intellectual and developmental disabilities were unable to have medical advocates by their side as they received treatment, whether it was for COVID-19 or another unrelated medical issue. Family members were, in many cases, not allowed to see their loved ones who lived in residential settings. And so a lot of confusion started to arise, and quite frankly, a lot of worry took place. And when it came to the medical facilities especially, this violated the Americans with Disabilities Act, it violated the Rehabilitation Act, and the state Arizonans with Disabilities Act. And so, these laws are in place to require that healthcare facilities allow for reasonable accommodations for their individuals with cognitive and communication disabilities in order to receive proper treatment. It's not just the adults, though, that quickly it became clear were struggling with a lot of the disruption. The students who relied on special education were really struggling, and it's remained a struggle throughout both last year and this school year as a lot of distance online learning has taken place. Some students haven't been able to get their full services. And so in June, Governor Doug Ducey did issue an executive order that declared students with disabilities have rights to receive a free, appropriate public education in person and to receive some of their services and their classes on site in person, if that is something that the family chooses to take advantage of. As a result of all of these issues, community organizations stepped up to the plate, both disability and non-disability focused organizations. They provided funding, and that was a really positive thing. And disability advocacy groups have also been successful in writing letters, advocating and speaking up at the state agency level for ease of delivery of services, so that people with IDD don't get forgotten amidst the pandemic. And we've seen some improvements in the system, particularly when it comes to telehealth. Also making habilitation and employment services available online, and also creating rules for protecting the health of staffers and those that they serve. That's been a really big deal. I'm looking at my notes here. Another accomplishment, especially early on, was some quick deployment of emergency wage hikes for caregivers providing direct care, and that was really needed because families didn't want tons of people coming into their home. They wanted a slimmed down care team, but of course those individuals were putting themselves at risk, and so those higher wages were really helpful. We expect a lot of these to stick around long term, or at least a portion. Even after the state of emergency has been lifted, we know that state agencies are going to have the telehealth services stick around in some greater capacity, and also more options for things like respite and being a little bit more creative with some of these things. So we anticipate changes there, and also more funding. State agencies have discovered their own administrator staff can work from home, and so offices have closed down, saving them rent and utility costs, and that translates into more money for direct care. So we'll see what the future holds. But thanks for listening.